Coming to background slide, the solid ankle AFO is commonly prescribed in Kudra patients in order to maintain the foot in plantigrade position. This facilitates easy ground clearance during swing phase and prevents toe tracking. It is a project, so there is certain modifications in the molding process and placement of reinforcement in proper place that improves the load bearing capacity of the orthosis to a much higher extent. Although the orthosis is fabricated from regular polypropylene sheet, as a result, this design is proved to be beneficial as it maintains its stability during ambulation in case patients more than 100 kg weight without compromising the cosmesis as well as affordability. Then the introduction part. The most commonly used category of orthotic device is the lower extremity orthosis. While design features changed slowly over the many decades, in recent years, engineering skills were applied to their design and new plastic materials and fiber impregnated sheets became available with higher strength, leading rapidly changing variety of orthotic design. The orthosis for neuromuscular disorder are designed to permit safe and effective ambulation to the patients with weakness resulting from lower motor neuron disease or muscle pathology. They may also prevent the development of deformity and require modification in design to accommodate spasticity and muscle imbalance. These are the pictures of reinforced AFO. The reinforced AFO with the patient applied over the total length. Then most patients with weakness around the ankle and foot are able to ambulate without an orthosis. However, they may exhibit gait deviation and thus injure themselves due to faulty pattern of walking. Therefore, the most common purpose of bracing is to ensure safe ambulation. The orthosis should provide mediolateral stability with the ankle during the stance phase to prevent inadvertent turn of the ankle and toe pickup during the swing phase to prevent a stumble caused by toe track during the swing. The demands of fulfilling these above maintained tasks during ambulation require an orthosis of proper strength with respect to the weight of the patient. If the plastic material compressed under the effect of orthosis was nowhere helpful in supporting the body segment. Nowadays, high-strength carbon fiber sheets are available that provide ultimate strength and can take more than 100 kg weight without any sign of failure. But use of these sheets will increase the cost of the orthosis to a great extent, and as far as the prescription of these high-strength orthoses are concerned in Asian subcontinent, so mostly in underdeveloped countries, these are hard enough to afford by the users from low economic strata. Thus, by utilizing some reinforcing technique on the conventional low-cost plastic sheets, we have tried to design a reinforced AFO which can withstand under high amount of loading, that is more than 100 kg, with minimal affecting the manufacturing and cost head. Then methods. Design concept. Although the AFO design is based on the principle of solid ankle foot orthosis, but placement of reinforcement and slight change in molding process provides enormous strength to the orthosis. So a dual layer molding at the shank section gives more rigidity to the vertical structure, while the placement of the other reinforcement like over the border of the malleoli and the navicular level aids in high weight withstanding capacity of the orthosis. Then fabrication procedure will be elaborated by Rudranarayan.
Good afternoon, everyone. Coming to the fabrication procedure, we have taken the cast by maintaining the subtalar neutral position. After the modification, a pattern of T-shaped reinforced is marked from the posterior aspect and extend distally following the gastrocnemius muscle up to malleolus level. That T pattern was cut, and by matching the pattern, a similar shape of 6 mm brown polypropylene sheet was cut. Then another polypropylene sheet was cut by taking the dimension of AFO, length from maximum cap to toe plus 2 inches, and width by taking the circumference at maximum cap plus 2 inches and instep circumference plus 2 inches. Both the sheet are placed over Teflon sheet and placed the preheated oven at the pressure about 200 Celsius. When both the sheets were melted properly, then first I took the T-shaped pattern carefully and placed it on the shank area by maintaining the horizontal part of the T marking and maximum calf area. To maintain this position, two nails without head were hammered carefully into